Good evening, everyone. Welcome to a brand new episode of BMC Global Live AL-HILAL Health World, nothing but lifestyle. I'm Anupama Menon. As the saying goes, health is wealth. In this talk show, Health World, we have expert doctors from various fields providing valuable information and guidance to all of you so that you can keep diseases at bay and enjoy good health. Today, we are happy to have with us Dr. Thanveer Moideen, dentist at Al-Hilal Hospital, Rifa. Dr. Thanveer has 12 years of experience in dentistry and his area of expertise is periodontics. Today, 31st May, is World No Tobacco Day. So, Dr. Thanveer will shed light on the ill effects of tobacco on oral health. Thank you so much for joining us on the show, Doctor, and welcome to the show.
Thank you for having me, and good to be here.
Our pleasure. Doctor, so what is the WHO theme for the World No Tobacco Day this year, 2022?
This year, the WHO theme is protect the environment. Tobacco, along with all the ill effects that are there for the human life, right from the lungs, the cardiac issues, the oral health issues, it also affects the planet in a major way. Roughly about 600 million trees are cut down every year. About 200,000 hectares of land deforestation happens every year. There is 22 billion tons of water which is being used up in the production of all the tobacco products every year, and about 84 million tons of carbon dioxide which is emitted into the environment every year because of the production of tobacco. So, along with all the ill effects of having on the health, it also affects the environment. So, the theme this year is to protect the environment.
So, it has a very negative impact on
Definitely.
the environment. And so, doctor, what are the problems, the health problems caused by the usage of tobacco? If you could just elaborate on that.
As many of them are aware, as almost everybody is aware of the issues on the cardiac, that is the heart problems that are associated because of tobacco smoking, the lung diseases that come. There is a major impact on the oral health issues as well. So, in the most simple form, it would be in the form of gum diseases, the stains, bad breath. There is increased prevalence or incidence of caries in smokers, as well as the major or the drastic effects which may be in the form of cancer. Now, tobacco can be consumed in various forms, right from that is snuff, cigarettes, vaping, tobacco chewing, betel nut chewing, all these are forms of tobacco. Okay. Now, almost everything has a negative effect on the oral issues. So, in short, effects right from the very start, I mean as soon as you start the habit, it can manifest problems in the oral tissues as well. And as the severity of your habit increases or the time duration increases, the problems multifold, I mean it keeps increasing manyfold.
Okay, so you said it depends on the duration, even though it may start in the beginning itself. So what are the long term implications? Let's say somebody is a chain smoker maybe for 15-20 years, or somebody is into tobacco for a long period of time. So what could be the long term implications of this
kind? Long term effects can be in the form of extreme poor gum health or even tooth loss. Many patients come back and they say that they were chewing something and the tooth just fell off. So, it can lead to complete loss of teeth. Like I said, it can even without the patient being unaware, the patient may end up with carcinomas or cancer of the mouth. So, yes, it has quite a severe long term implication.
Okay, and doctor, you spoke about smoking and vaping, which is something very common, especially vaping in Middle East. And I think there's a general impression that vaping is not as harmful as smoking. So is it a myth, and how much does smoking and vaping affect your oral health? And
at the end, both are forms of tobacco. Now, of course, there are various studies which are, because vaping is relatively new, there are not many studies which are yet to be published, at least long term studies which are yet to be published because of the effects of vaping as such. But we are not aware of all the ingredients in the vape that is present. There may be various chemicals, toxic chemicals in these vaping products which again can have a deleterious effect on the oral health.
And let's say somebody is a chain smoker or is heavily into the usage of tobacco, and with all these health implications, let's say that person decides to give up smoking or vaping once and for all. What would be your suggestion? How does a person go about that?
First and foremost is that one needs to make up his mind. That is very important, because many people, what we see, especially when towards the new year and everything, they make a resolution that we are going to stop,
broken,
yeah,
yes.
but then they break it. That's only because they are not really firm on their decision. So first and foremost, one needs to be firm on the decision,
make up their minds,
make up
have
their
a strong
mind
resolve.
and have a strong focus towards it, that no matter what, we are not going to get back into the habit. The second being, there are nicotine patches which are available, which can help in the initial phases to get over, because nicotine is it's an addictive substance. So when there is the sudden stoppage of it, they do experience certain apprehensions and withdrawal symptoms. So that can be overcome with the use of nicotine patches, as well as support groups. It is always beneficial to have a support group wherever anybody, it may be a relative, it may be your family member, it may be your friend, who, when you feel the urge to smoke, you just divert your mind and maybe call them, speak to them, and that helps. They reinforce your positive talk and everything, and then they can break down on cut down the urge to smoke.
Since it's an addiction, I guess the most important thing is your willpower and your decision to stay away from it completely.
Absolutely.
And when do you think a patient should see the doctor, when oral problems occur? What are the major symptoms that should prompt a person to go and visit the dentist or doctor?
Yeah, so see, ideally, it is always the saying, prevention is better than cure. So it is not necessary that you have a problem and then visit the dentist. That's a common misconception. That is what we have. When we have a problem, we will visit the doctor. But that is a very wrong thing. That's detrimental. Ideally, one needs to, irrespective of whether he or she is having any habit or not, ideally needs to visit a dentist at regular intervals of time. Now the time is going to be decided by the dentist based on the person's oral health and the complicating factors that may be present in the mouth. So, but that said, the most common symptoms will be in the form of swelling in the gums, bleeding while brushing or chewing hard food. There may be some amount of sensitivity, which is usually because of the gums receding, and also in the form of pain. They may experience some pain or discomfort while chewing. So these are the most common symptoms.
And it's better not to delay and then
absolutely.
See a
it
doctor
is definitely, it is always a routine checkup is better than going in for a problem.
And doctor, smokers are generally more prone to having gum problems and cancer, and complications could also arise due to surgery. Is this true? Are smokers at a higher risk?
Yes, absolutely. Various long-term studies, and by long-term we mean 10-15 years studies wherein doctors have followed up these patients over a prolonged period of time, has shown that smokers in general, if they smoke even say less than 10 cigarettes a day, they are about 4 to 5 times more prone to gum diseases when compared to a non-smoker.
And this has been proven by
scientific data, absolutely. So and people who smoke more have even 7 to 8 times more gum diseases when compared to a non-smoker. Also, like you rightly said, with regards to the healing, so what happens is that when a person is a smoker, the healing is delayed, the healing is impaired, as in the amount of healing that can be that is seen in a smoker is less when compared to a non-smoker. So this is because the blood vessels invariably shrink. In simplest of terms, there is vasoconstriction. So the blood flow to the site, the gum and the gum region reduces, thereby impairing the healing process.
So smokers take longer time to heal if there are any complications.
Not just a longer time, they don't heal completely when compared to a non-smoker.
And doctor, in so many years of experience, can you think of, have you ever come across any case where the patient has been severely affected by the usage of tobacco?
Definitely, we have seen many cases, especially people who chew a lot of tobacco. Now that we have seen, there are many stages of cancer. There is something called as precancerous conditions, and then there are malignant conditions. Now these precancerous conditions are basically wherein we don't call them cancers yet, but they have a tendency to, if the habit persists,
continues,
then there is a possibility, higher possibility wherein it may get converted into cancer. So we have seen such cases, and with regards to smoking, there are a lot of patients who come, chronic smokers especially, who we see that their gum health is so poor, the teeth are so badly mobile that nothing can be done apart from an extraction. So they lose their teeth, and then even to replace teeth in such patients is a difficult task because
their gums have been affected.
The bone is affected.
Oh, even the bones are affected?
Exactly. Okay. So gum disease is basically not just restricted to the tooth or the gum alone, it affects the bone which is supporting the tooth. So once the bone height decreases, that is when the tooth usually starts moving. It becomes loose because there is nothing holding the tooth, and then invariably we may have to extract the tooth, and then because the bone height is less, even replacement becomes difficult in the form of fixed teeth because they don't have good bone support on the other adjacent teeth, as well as implants, there is not enough bone height. So it has various complications in future.
Doctor, I have heard that in the case of smokers, post-extraction there tends to be more complications. Could you please elaborate on that?
Yes. What happens is when a person smokes, like I said, that the blood supply to the area is diminished in smokers. So when we extract, and if a person smokes within the first 3 to 4 days of extraction, there is a higher incidence of what we call a dry socket. So that is basically there is no blood formation in the extraction site. So once there is no blood, the bone gets exposed to the oral cavity, which is then it is associated with higher pain, increased pain, delayed wound healing, and the patient also feels very foul odor in the mouth because of this. So that is again a very important complication, that is a very common complication rather that we see in smokers, especially post extraction. So we always advise patients not to smoke post extraction, and it is very important that they follow this instruction.
And how many days post extraction?
Ideally it would be about a week.
Okay.
But chronic smokers, they may not be able to stop that much, but at least 3 to 4 days, so that the initial healing has happened.
Okay.
And then healing will follow, but it will be delayed, but it will follow without any complications.
Okay. And doctor, what about the stains caused by the usage of tobacco? Are they removable, or how do you
majority of the stains are removable, except for the stains which are present on the grooves of teeth. That we may not be able to remove because the tooth is not a flat object, it is not a smooth object. There are various grooves on it developmentally which are present. Now these grooves also get stained, and we may not be able to remove them completely. But in general, yes, about 99.9% of the stains can be removed.
And doctor, before we wrap up, any words of advice to our viewers on how to stay away from tobacco and how to maintain their oral health in general?
The first and foremost would be to all the youngsters, never start. I mean, I know it's, there is a lot of peer pressure which comes in, but stay away from it. In fact, staying away from tobacco is a lot more cooler than having stained teeth, poor oral health, and then eventually losing your teeth and having no teeth to smile. So that is much worse than getting into the habit. So stay away from the habit. Unfortunate people who have already in the habit, please make up your minds and stay focused and give up the habit as soon as possible.
Yes, doctor, I guess this is a wake-up call to all the chain smokers and heavy tobacco users. Since we know about the long-term implications and how harmful it can be for your health, I think everyone should make an effort to stay away from tobacco. Absolutely. Thank you so much, doctor, for explaining to us in detail about this issue. Thank you for joining us.
Thank you.
Friends, make your health a priority. Please follow doctor's advice and stay away from tobacco, smoking and vaping, because it can be very harmful for your health. For more informative episodes like this, don't forget to tune in to BMC Global Live Al-Hilal Health World every Tuesday at 8 p.m. Thank you for watching this show. Till we meet again next time, this is Anupama signing off. Good night and stay safe.